What are some of your favorite peptides? And what do
Me?
you, yeah.
What am I taking right
exactly.
now?
What are you taking? I want to know it all.
Okay. So what am I doing? I'm perimenopausal, so I'm doing Semax and Selank.
Okay, why?
I'm
Why
emotionally
those?
volatile at the moment, right?
Wait, why are you doing Selank and Semax?
Because it works on brain, my BDNF, my brain
Okay.
neurotrophic factor.
Amazing. Okay.
It also works on my GABAergic systems as well, and it works on my adrenal cortical axis. So it reduces my stress level.
Okay.
I can add pineal to it if I want to, but I don't take that. I only take 2, Semax and Selank. I take delta sleep-induced peptide intermittently when I can't sleep.
Okay.
I'm not a fan of sleeping tablets or anything like that.
Okay.
Right. And then when I was on, and this is this is good learning for your listeners, I've been a big fan of GLP and GIP-1 inhibitors. The reason being is I knew they were here to stay. I've had them for 10 years. We're doing a lot of research with them, and we knew they were going to be here to stay for longevity.
Right.
Because we saw the effects on fertility.
Yeah.
We saw the effects on inflammation. We saw the effects on microdosing them. Yeah. So I'm not a fan of saying, get on Mounjaro, start at 2.5, go all the way to 10 to 15.
It's 0.5 is the proper microdose.
Or go microdosing. Yeah. So, or go on Wegovy or Ozempic, or the new one, Retatrutide. Like, I'm saying to you, microdose it, divide it by 1,000. Like, so what we do with our patients who need to debulk, right, who need to lose a bit more, who are insulin resistant, or have got PCOS, or just can't move the weight after IVF and whatever it is, or they're menopause, because men go through menopause as well.
Men go through menopause?
Men go through menopause.
No,
they get testosterone.
but for real?
They go through. They do.
Is it
man.
like,
Let's
really?
be nice to them. They do.
No, tell me about this. I want to know about this.
They go through their own testosterone decline. I'll come to it in a minute.
Okay.
But what we do with I always say this, and I give free. Our videos go viral, Iman, because we give our protocols out.
Yeah.
And we literally get reposted in different languages all around the world. Because I say to you, do not take a GLP-1 or GIP inhibitor blindly by yourself, combine it with a peptide, combine it with CJC and Ipamorelin, because it wastes your muscle.
Yeah.
And also, you don't want to go to the highest dose, because once you go to the highest dose,
then you're screwed.
Where are you going to
go from there?
And you're going to get rebound.
Yeah.
So you want a CJC will help you not go to the higher dose. It's naturally found in your body, so you maintain your metabolism. Ipamorelin will protect your muscle loss, because I need my muscle, because muscle fat burns, right?
Yeah.
Then what we do is then we say, okay, listen, if you're on Mounjaro, or let's pretend you're on Wegovy, we say, okay, you're on 0.25, we've weaned you down. Yeah. We're now going to divide that 0.25 by 1,000, and we're going to microdose you on that, whilst we keep you on the peptides. And you know about peptides, you stack peptides, 3 months on, 3 months off, depending on what you want to do. So right now I'm working on my perimenopause, right? Okay. I've done all my rounds of IVF and everything, I've cleaned up my body. So now I'm working on my perimenopause. My next phase for me, like you mentioned, I'm going to work on my longevity. Yeah. That's going to be my BPC-157, my Epitalon, that's what I'm going to work on. And I'll go through stacking. And what I want to do is I don't want to drug myself or anything like that. And I don't want to be injecting myself the rest of my life. Yeah. I'm going to be on and off. 1 year I might do this, another year I might do another. Yeah. I want my body to start working itself.
For you, yeah, because you can't constantly be supplementing.
Yeah.